Listen, can we name a single party that has backed, without hesitation, the demands of the provinces across Canada and of Quebec for healthcare transfers? Just saying transfers, the Liberals will say $4 billion this year. We're far from the count. The Conservatives say we'll double the healthcare transfers. Of course, we'll bring them to the 6% that had brought to 3% because of Harper. We're extremely far from what we need. We have to do more on a subject like this than using words. We have to use numbers. All provinces unanimously, including, of course, Quebec, supported by unanimous vote in the Assemblée nationale of Quebec, an increase that is much more significant in these healthcare transfers. Quebec and the provinces have reiterated in a letter to the President of the Federation, an increase of 35%. That would involve this year $28 billion, an increase of $28 billion from the federal government. Now, of course, for it to be sustainable and very obviously, without conditions. Why healthcare transfers? Because for the public, it's like a politician's trick. Why healthcare transfers? To reduce waiting lists for surgery, really high, to increase and improve treatment and the working shifts of nursing staff, to increase the number of workers in long-term care homes, and also to come back to what we were saying yesterday, better prepare, better adapt, have a system, a healthcare system that's more robust to face possible crises like the one we're going through right now, and future crises or future iterations of the current pandemic, to accord importance that's more sustainable to healthcare systems that our seniors need, or to make sure that the Gatineau Hospital emergency not be open from 6 to 8 after being closed for 2 months. I know no one who waits till 8:30 to break a leg. An emergency in a city like Gatineau, it's even ridiculous to say it's an essential service. We're not in the far north, and they too deserve emergency cities. But we're in one of the biggest cities in Quebec, highest population. And for all of that, we need healthcare transfer systems that are concrete, because the needs are concrete, because the need is concrete. I saw Mr. Pallister's letter, and I answered that he would have our clear, total, and unconditional support. We will not fall for the tricks of the hollow words of the Liberals and Conservatives in terms of healthcare transfers. When the Prime Minister Trudeau decides alone, when Prime Minister Trudeau is completely isolated in his position to refuse unconditional healthcare transfers, who is he serving? He's clearly not serving the provinces. And overall, in all full honesty, he is not at the service of Quebecers in terms of healthcare transfers. People will have to act and analyze their votes on September 20th as a consequence. We'll start now with the question period with one question and a follow-up. We'll start with questions on the ground, followed by virtual. Here's the first question. In your letter, you have evoked a clear plan 35%, is that 28 billion? Yeah, 28 billion this year, and is indexed annually. And this would carry over how many years, in your view? How many years should we apply the 35%? Well, if we put the 28 billion this year, that's the 35%. This is not a clear plan. You're not presuming that the federal government will pay this out the first year. I expect the federal government to not pay out at all. I thought if the federal government would be a little bit of openness, there would be a conversation, but if the provinces in Quebec, and it's been tried in the past, if they are open and flexible with this issue, we're all of a sudden off on a tangent and that serves nothing. So provinces that will make their own negotiations with the future government, provinces need an extremely firm and clear position, otherwise it'll go nowhere. Is this the first time you address Premier Pallister? Yes. Next question. Aaron O'Toole is proposing a contract to Quebecers in which he's offering to increase healthcare transfers. You'll say it doesn't reach the levels that the provinces want. He's proposing an annual increase of 6%. Aaron O'Toole said this morning, that if there's more economic growth, we'll accelerate. Do you not see that as an interesting proposal? No. First, the slogan is cute. I'm offering you a contract. However, the cute slogan is nothing more than an election promise. And election promises, as opposed to a contract, are often not respected. In terms of healthcare transfers, all Mr. O'Toole is proposing is to partially fix the error of his predecessor, Mr. Harper. It's far, far, far from the 35% increase. 6% annually, it takes years to get 35%. It's high time it happened. It's once again compromising. At least for Canada, we understand that Quebec should continue to receive as part of this money without the conditions. But like he's turning his back on the Quebec plan for daycare. He says he's pro-choice, but his caucus is pro-life. Conservative values in terms of oil and gas exploration. He can say, I believe in climate change. He uses the words climate change or healthcare transfer. It's a word. We believe in climate change, and we're acting to fight climate change. And if we're fighting climate change, we can't increase extraction and delivery of Canadian oil and gas. The differences, contract, no contract, cute, not cute, the differences between the conservative values and Quebec values are no smaller this morning than they were yesterday. And with this conservative platform, conservative leaders are promising to protect the rights of conscience for healthcare professionals. What do you see? Oh, this looks like an ambiguous format to please a lot of people. Healthcare professionals, for example, I see where that's going. Some are more enthusiasm with the medical aid for dying. It's a little like their position on abortion. If healthcare professionals don't agree with the state policy, does that mean that they don't have to function within that framework? Fundamentally, before the election, Conservatives adopt the programs of the Bloc Quebecois for appearances. And then after the election, they go back to the Alberta plan. Next question. You're in a region this morning that's probably the worst for healthcare in Quebec, even before the pandemic. Again, this morning, my newspaper showed that waiting lists have increased by 80% since the pandemic. There's no measure in Quebec, and probably no common measures across Canada. The Udaway spends hundreds of millions of dollars take care of people from Ontario. You're talking about healthcare transfers this morning. Can the federal government do more to maybe better organize healthcare? Not organize, but respond to a border situation like ours. The border situation is caused by unbalance between healthcare system in the Outaouais and in Ottawa. Of course, there's displacement of professionals toward Ontario, where salaries are higher. And of course, people want to go where they get the fastest healthcare system. It draws them from Ontario. The situation to that is certainly not to encourage more federal involvement in provincial jurisdiction on healthcare system. The answer is to better finance the healthcare system in Quebec that can reposition its offer and position and geographically. So is it a question of money or training of the personnel? We can't get around the question of money. We can't pretend that a difference made by $28 billion is not a factor in the offer of healthcare system in the region. Next question. You've spoken a bit about the difference between Quebec and Ontario. In your view, concretely, what makes the difference that the healthcare system in Quebec is often negative as compared to other provinces? For example, in Ottawa, in Outaouais. There's a number of issues. In Outaouais, there's the geographic and competitive position, and also the age of the people. It's extremely important in Quebec, the demand for healthcare in a population, and an aging population, and that deserves fully the healthcare required, in addition to all the promises of the state and the increase in pensions, of course. But healthcare is one of the main factors, and year over year it creates a gap that only gets wider. And the provinces and the leader of Quebec and the Assemblée nationale unanimously want to fix first with a substantial increase in funding. Historically, it was supposed to be 50% by federal. Right now it's 22%. It has to go up to 35%. It's only normal. Is there a model here or around the world that we might follow? It's always a good idea to get inspired by what others are doing. Next question. You're talking about money, but the nurses here in Outaouais who are watching, concretely it's to get more money. You're talking about bonuses? How are you going to find the personnel? I'll draw the line before I get there. My work, in the interest of all Quebecers and the entirety of Assemblée nationale Quebec, have asked me to go get 35% of the budget for the healthcare systems for Quebec and the provinces. Once that money is in Quebec, it will be exclusively up to the Assemblée nationale du Québec to proceed. Now, if we can help in the Bloc Quebecois, if we can help, we will. We have candidates. For example, union leader for nursing in Mauricie, and Julie Bouchard, our candidate in Saguenay. The cause, the understanding, awareness and compassion for nursing staff that is overtaxed in terms of work. So we are aware of that. So these are not election promises? I don't understand the question. Obviously, we're in a campaign. People are going to announce amounts, promises. Oh, you're talking about Conservatives and Liberals. They put $4 million in their budget $4 billion just this year, and that's it? And the Conservatives, is that a campaign promise? Obviously, it's not a very big one. To going from 3 to 6% of annual increase does not bring us to our desired deadline before a long, long time. Everything is hypothetical. And with a Conservative government, we wouldn't even be where we are.
Bonjour, Mr. Blanchet. A few days ago, you were advocating for billions of dollars to be sent to Alberta as long as Alberta spends that on transitioning away from fossil fuels. This morning, you're saying, and I'm kind of translating on the fly here, you're concerned about the Conservatives during a campaign taking the positions of the Bloc Quebecois and then post-campaign turning around and adopting the positions of Alberta. Is there not a bit of a contradiction there, and would you not agree that a federal government has to appeal to all parts of the country they wish to govern?
I'm sure they do, but in that specific circumstance, they should appeal to the whole planet, because the whole planet would tell the Conservatives and the Liberals, who have given even more money to oil and gas than the Conservatives of Stephen Harper before them. They should appeal to this fight that we have to fight against climate change. And it is not a matter of being useful for all the parts of the country to say that they will support oil and gas and fossil energy. It is useful for nobody. This is why I say, and I don't know what would be the formula precisely, and I'm not part of the negotiations that would have to take place between Alberta and the federal government. I'm only saying that there's an effort that could come with some money, it could come with a lot of money, to help Albertan workers get out of this sad business of oil and gas and go toward other forms of energy and other types of economy.
Okay. And speaking a bit more closely to Quebec now, the Liberals have been working pretty closely with François Legault's government. Why would Quebecers need to vote for you when they're getting commitments from the Liberals?
Because Justin Trudeau would not have worked closely with François Legault if we would not have been there. That's quite clear. The lack of respect that the federal government and most of them all, Justin Trudeau, has quite often for Quebec, would have been much more important in the way he would have managed the country and his relation with Quebec. We are in support of the National Assembly of Quebec in many regards. And this idea that Mr. Trudeau is close to Quebec or to Quebec government does not appear that true to me. Quebec has made 7 demands before last election. Not one, not a single one of the 7 demands of Quebec has been met. Not one.
Nous allons maintenant procéder à la période de questions en mode virtuel.
We'll now move to the virtual questions.
Média en mode virtuel, je cède la parole à Claudie Côté de TVA.
From TVA.
Bonjour, Monsieur Blanchet. Est-ce que vous m'entendez bien?
Do you hear me? Yes.
Parfait.
Perfect.
Ma première question, j'aimerais revenir un peu sur
My first question,
hier du Parti conservateur.
I'd like to go back to the Conservative announcement yesterday, the contract with the Quebecers. In this contract, we're talking about a partnership, federalist, healthcare transfers, respecting provincial jurisdictions. Is that not exactly what you're asking for as Bloc Québécois? You mentioned election campaigns and shouldn't be respected, but you're making some yourself right now. It's not always respected from one, from the other thing. The chances of me becoming Prime Minister of Canada are fairly low, but the formulations you've raised, federalism, partnership, contract from the Conservatives. These are pretty phrases and slogans, but they don't change the essence of the fundamental differences between what the Conservatives are proposing and what Quebec is demanding in healthcare transfer and daycare systems, and then medically aided dying and abortion. And the compulsive attachment of Conservatives. They have no choice for the oil of Alberta. They want to increase extraction and exploration, transportation. A slogan doesn't change the essence of a political party. My fear is that, particularly in their campaign in Quebec, the Conservatives are fooling themselves by inventing for themselves a relationship with Quebec. It's a pretty slogan, but as the weeks come, they will get closer to what Ontario, Saskatchewan, Newfoundland want. They won't say to Newfoundland that the terrible financing of Muskrat Falls. We could multiply the examples. I do not believe that the Conservative campaign will reveal proximity to what Quebecers want. I think it's very, very, very hypothetical. If the Conservatives get to power, there won't be much left of that. Thank you. I'd like to go back to... You talked about the right of conscience of physicians that the Conservatives brought up, which applies to medically aided dying. And we've questioned O'Toole on abortion. Do you believe that they will respect the right to abortion? He says that he is personally against the Bill 21, but he will not. He's committed to not touching it. What do you think of that? I think that a statesman should always believe, or a leader should always follow his conscience. He says on abortion, he says, I'm acting according to my conscience, I'm pro-choice, even if the majority of my caucus is not pro-choice. And in terms of medical assistance to dying, he says, I won't go with my conscience because I'm against that, but I will still leave it alone. There's like a dichotomy between his personal convictions. I'm clear. Medical assistance for dying is not only one of the biggest progresses of compassion in recent history, which came from Quebec. Quebecers are deeply attached to that. I am too. The right for women to deal with their own bodies is a value that's deeply rooted among Quebecers and me. I am clear, and I will not go back and forth with compromises on these issues. Thank you. That's all there is for virtual questions.